Don't stop. Don't stop. Don't stop. Don't stop. Don't stop. Don't stop.
How can diabetes affect the feet? People with diabetes are prone to foot problems that develop due to prolonged periods of high blood sugar levels. Diabetic neuropathy and peripheral vascular disease are the two main foot problems that occur, and both can have serious complications. Prolonged periods of high sugar levels in the blood can damage many areas of the body, including the feet. Diabetes is responsible for over 50% of all foot amputations in the United States. Diabetes can cause two problems that can affect your feet: 1. Diabetic neuropathy. 2. Peripheral neuropathy. Peripheral neuropathy is the most common type of diabetic neuropathy. It affects the feet and legs first, followed by the hands and arms. Signs and symptoms of peripheral neuropathy are often worse at night, and may include numbness or reduced ability to feel pain or temperature changes, tingling or burning sensation, sharp pains or cramps, increased sensitivity to touch. For some people, even the weight of a bed sheet can be painful. Muscle weakness, loss of reflexes, especially in the ankle, loss of balance and coordination. Serious foot problems, such as ulcers, infections, and bone and joint pain. 2. Autonomic neuropathy. The autonomic nervous system controls your heart, bladder, stomach, intestines, sex organs, and eyes. Diabetes can affect nerves in any of these areas, possibly causing a lack of awareness that blood sugar levels are low, hypoglycemia unawareness. Bladder problems, including urinary tract infections or urinary retention or incontinence. Constipation, uncontrolled diarrhea, or both. Slow stomach emptying, gastroparesis, causing nausea, vomiting, bloating and loss of appetite. Difficulty swallowing. Increased or decreased sweating. Problems controlling body temperature. Changes in the way your eyes adjust from light to dark. Increased heart rate at rest. Sharp drops in blood pressure after sitting or standing that may cause you to faint or feel lightheaded. Erectile dysfunction. Vaginal dryness. Decreased sexual response. 3. Radiculoplexus neuropathy. Other names for this type are: 1. Diabetic amyotrophy. 2. Femoral neuropathy. 3. Proximal neuropathy. Radiculoplexus neuropathy affects nerves in the thighs, hips, buttocks, legs. It's more common in people with type 2 diabetes and older adults. Symptoms are usually on one side of the body, but sometimes may spread to the other side. You may have 1. Severe pain in a hip and thigh or buttock that occurs in a day or more. 2. Eventual weak and shrinking thigh muscles. 3. Difficulty rising from a sitting position. 4. Abdominal swelling, if the abdomen is affected. 5. Weight loss. Most people improve at least partially over time, though symptoms may worsen before they get better. 4. Mononeuropathy. Mononeuropathy, or focal neuropathy, is damage to a specific nerve in the face, middle of the body, torso, or leg. It's most common in older adults. Mononeuropathy often strikes suddenly and can cause severe pain. However, it usually doesn't cause any long-term problems. Symptoms usually go away without treatment over a few weeks or months. Your specific signs and symptoms depend on which nerve is involved. You may have pain in the shin or foot, lower back or pelvis, front of thigh, chest or abdomen. Mononeuropathy may also cause nerve problems in the eyes and face, leading to difficulty focusing, double vision, aching behind one eye, paralysis on one side of your face, Bell's palsy. Sometimes mononeuropathy occurs when something is pressing on a nerve, nerve compression. Carpal tunnel syndrome is a common type of compression neuropathy in people with diabetes. It can cause numbness or tingling in your hand or fingers, except your pinky, little finger. Your hand may feel weak, and you may drop things. Peripheral vascular disease. Diabetes also affects the flow of blood. Without good blood flow, it takes longer for a sore or cut to heal. Poor blood flow in the arms and legs is called peripheral vascular disease. If you have an infection that will not heal because of poor blood flow, you are at risk for developing ulcers or gangrene. Peripheral artery disease, PAD, sometimes referred to as peripheral vascular disease, PVD, means that there is narrowing or occlusion by atherosclerotic plagues of arteries outside of the heart and brain. This is sometimes referred to as hardening of the arteries. Diabetes is a known risk factor for developing peripheral artery disease. In addition to pain in the calves during exercise, medically known as intermittent claudication, the signs and symptoms of peripheral artery disease relate to a decreased delivery of oxygen to the lower legs and feet. In severe cases, the lack of oxygen delivery to tissues can result in ulcers and even gangrene, tissue death. What are some common foot problems with diabetes? Anyone can get the foot problems listed below. For people with diabetes, however, these common foot problems can lead to infection and serious complications, such as 1. Amputation. 2. Athlete's foot. Athlete's foot is a fungus that causes itching, redness, and cracking. Germs can enter through the cracks in your skin and cause an infection. Medicines that kill the fungus can treat athlete's foot. 2. Fungal infection of nails. Nails that are infected with a fungus may become discolored, yellowish-brown or opaque, thick, and brittle, and may separate from the rest of your nail. In some cases, your nail may crumble. The dark, moist, and warm environment of shoes can help a fungus grow. An injury to your nail can also lead to a fungal infection. Fungal nail infections are hard to treat. Medications applied to the nail are available, but they only help a small number of fungal nail problems. You may need prescription medicine that you take by mouth. Your doctor might also remove the damaged nail. 3. Calluses. A callus is a buildup of hard skin, usually on the underside of the foot. Calluses are caused by an uneven distribution of weight. Calluses also can be caused by poorly fitting shoes or by a skin problem. It's normal to have some callus on your foot, so your doctor will decide if your callus is causing problems. If you have a callus, take care of it properly. After your bath or shower, use a pumice stone to gently remove the built-up tissue. Use cushioned pads and insoles in your shoes. Medications can soften calluses. Do not try to cut the callus or remove it with a sharp object. 4. Corns. A corn is a buildup of hard skin near a bony area of a toe or between toes. Corns may happen because of pressure from shoes that rub against your toes or cause friction between your toes. Be sure to take care of them properly. After your bath or shower, use a pumice stone to gently remove the built-up tissue. Do not use over-the-counter remedies to dissolve corns. Do not try to cut the corn or remove it with a sharp object. 5. Blisters. Blisters can form when your shoes rub the same spot on your foot. Wearing shoes that do not fit properly or wearing shoes without socks can cause blisters, which can become infected. When treating blisters, it's important not to pop them. The skin covering the blister helps protect it from infection. Use an antibacterial cream and clean, soft bandages to protect the skin and prevent infection. 6. Bunions. A bunion forms when your big toe bends toward your second toe. Often, the spot where your big toe joins your foot becomes red and calloused. This area also may stick out and become hard. Bunions can form on one or both feet. They may run in the family, but most often they're caused by wearing high-heeled shoes with narrow toes. These shoes put pressure on your big toe, pushing it toward your second toe. Felt or foam padding may help protect the bunion from irritation. Your doctor can also use a device to separate the big and second toes. If the bunion causes severe pain or deformity, you might need surgery to realign your toes. 7. Dry skin. Dry skin can crack, which can allow germs to enter. Use moisturizing soaps and lotions to keep your skin moist and soft. Ask your doctor which ones to use. 8. Diabetic ulcers. A foot ulcer is a break in the skin or a deep sore. They can become infected. Foot ulcers can happen from minor scrapes, cuts that heal slowly, or from the rubbing of shoes that do not fit well. It's important to treat them as soon as you notice them. Ask your doctor for advice on how to best care for your ulcer. Up to 10% of people with diabetes will get foot ulcers. 9. Hammer toes. A hammer toe is a toe that is bent because of a weakened muscle. The weakened muscle makes the tendons in your toe shorter, causing your toe to curl under your foot. Hammer toes can run in families. They can also be caused by shoes that are too short. Hammer toes can cause problems with walking and can lead to blisters, calluses, and sores. Splints and corrective shoes can treat them. In severe cases, you may need surgery to straighten your toes. 10. Ingrown toenails. Ingrown toenails happen when the edges of the nail grow into your skin. They cause pressure and pain along the nail edges. The edge of the nail may cut into your skin, causing redness, swelling, pain, drainage, and infection. The most common cause of ingrown toenails is pressure from shoes. Other causes include improperly trimmed nails, crowding of the toes, and repeated trauma to the feet from activities such as running, walking, or doing aerobics. Keep your toenails properly trimmed to prevent ingrown toenails. If you have a persistent problem or if you have a nail infection, you may need a doctor's care. Surgery to remove part of the toenail and growth plate can treat severe problems from ingrown toenails. 11. Plantar warts. Plantar warts look like calluses on the ball of the foot or on the heel. They may appear to have small pinholes or tiny black spots in the center. The warts are usually painful and may grow singly or in clusters. Plantar warts are caused by a virus that infects the outer layer of skin on the soles of the feet. If you are not sure if you have a plantar wart or a callus, let your doctor decide. They have several ways to remove them. Asterisk tips for diabetic foot care. Proper foot care can prevent these common foot problems or treat them before they cause serious complications. Here are some tips for good foot care. 1. Take care of yourself and your diabetes. 2. Follow your doctor's advice regarding nutrition, exercise, and medication. 3. Keep your blood sugar level within the range recommended by your doctor. 4. Wash your feet in warm water every day, using a mild soap. 5. Test the temperature of the water with your elbow because nerve damage can affect sensation in your hands. 2. 6. Do not soak your feet. 7. Dry your feet well, especially between your toes. 8. Check your feet every day for sores, blisters, redness, calluses, or any other problems. 9. If you have poor blood flow, it is especially important to check your feet daily. 10. If the skin on your feet is dry, keep it moist by applying lotion after you wash and dry your feet. 11. Do not put lotion between your toes. 12. Gently smooth corns and calluses with an emery board or pumice stone. 13. Do this after your bath or shower, when your skin is soft. 14. Move the emery board in only one direction. 15. Check your toenails once a week. 16. Trim your toenails with a nail clipper straight across. 17. Do not round off the corners of toenails or cut down on the sides of the nails. 18. After clipping, smooth the toenails with a nail file. 19. Always wear closed-toed shoes or slippers. 20. Do not wear sandals and do not walk barefoot, even around the house. 21. Always wear socks or stockings. 22. Wear socks or stockings that fit your feet well and have soft elastic. 23. Wear shoes that fit well. 24. Buy shoes made of canvas or leather and break them in slowly. 25. Extra wide shoes are also available in specialty stores that will allow for more room for the foot if you have a foot deformity. 26. Always check the inside of shoes to make sure that no objects are left inside. 27. Protect your feet from heat and cold. 28. Wear shoes at the beach or on hot pavement. 29. Wear socks at night if your feet get cold. 30. Keep the blood flowing to your feet. 31. Put your feet up when sitting, wiggle your toes and move your ankles several times a day, and don't cross your legs for long periods. 32. If you smoke, stop. 33. Smoking can make problems with blood flow worse. 34. If you have a foot problem that gets worse or won't heal, contact your doctor. 35. Make sure your diabetes doctor checks your feet during each checkup. Get a thorough foot exam once a year. 36. See your podiatrist, a foot doctor, every 2 to 3 months for checkups, even if you don't have any foot problems. Asterisk. If you have diabetes, contact your doctor if you have any of these problems: changes in skin color, changes in skin temperature, swelling in the foot or ankle, pain in the legs, open sores on the feet that are slow to heal or are draining, ingrown toenails or toenails infected with fungus, corns or calluses, dry cracks in the skin, especially around the heel, foot odor that is unusual or won't go away. Identifying symptoms and diagnosis. One of the first signs of a foot ulcer is drainage from your foot that might stain your socks or leak out in your shoe. Unusual swelling, irritation, redness, and odors from one or both feet are also common early symptoms of a foot ulcer. The most visible sign of a serious foot ulcer is black tissue, called eschar, surrounding the ulcer. This forms because of an absence of healthy blood flow to the area around the ulcer. Partial or complete gangrene, which refers to tissue death due to infections, can appear around the ulcer. In this case, odorous discharge, pain, and numbness can occur. Signs of foot ulcers are not always obvious. Sometimes, you won't even show symptoms of ulcers until the ulcer has become infected. Talk to your doctor if you begin to see any skin discoloration, especially tissue that has turned black, or feel any pain around an area that appears calloused or irritated. Your doctor will likely identify the seriousness of your ulcer on a scale of 0 to 3 using the following criteria: 0, no ulcer but foot at risk. 1, ulcer present but no infection. 2, ulcer deep, exposing joints and tendons. 3, extensive ulcers or abscesses from infection. Complications of diabetic foot problems: 1, skin and bone infections. A small cut or wound can lead to infections. Nerve and blood vessel damage. Along immune system problems, make them more likely. Most infections happen in wounds previously treated with antibiotics. Infections can be treated with antibiotics. Severe cases may require treatment in a hospital. 3, abscess. Sometimes infections eat into bones or tissue and create a pocket of pus called an abscess. The common treatment is to drain the abscess. It may require removal of some bone or tissue, but newer methods, like oxygen therapy, are less invasive. 4, gangrene. Diabetes affects the blood vessels that supply your fingers and toes. When blood flow is cut off, tissue can die. Treatment is usually oxygen therapy or surgery to remove the affected area. 5, deformities. Nerve damage can weaken the muscles in your feet and lead to problems like A, hammer toes, B, claw feet, C, prominent metatarsal heads, D, pes cavus, E, or a high arch that won't flatten when you put weight on it. 6, Charcot foot. Diabetes can weaken the bones in your foot so much that they break. Nerve damage can lessen sensation and prevent you from realizing it. You keep walking on broken bones and your foot will change shape. It might look like your arch has collapsed into a rocker shape. 7, amputation. Problems with blood flow and nerves make it more likely for people with diabetes to get a foot injury and not realize it until infection sets in. When an infection can't be healed, creates an abscess, or if low blood flow leads to gangrene, amputation is often the best treatment. Asterisk. Risk factors for diabetic foot ulcers. All people with diabetes are at risk for foot ulcers, which can have multiple causes. Some factors can increase the risk of foot ulcers, including poorly fitted or poor quality shoes, poor hygiene, not washing regularly or thoroughly, Improper trimming of toenails. Alcohol consumption. Eye disease from diabetes. Heart disease. Kidney disease. Obesity. Tobacco use inhibits blood circulation. Diabetic foot ulcers are also most common in older men. Asterisk treating diabetic foot ulcers, stay off your feet to prevent pain and ulcers. This is called offloading, and it's helpful for all forms of diabetic foot ulcers. Pressure from walking can make an infection worse and an ulcer expand. For people who are overweight, extra pressure may be the cause of ongoing foot pain. Your doctor may recommend wearing certain items to protect your feet, diabetic shoes, casts, food braces, compression wraps, shoe inserts to prevent corns and calluses. Doctors can remove diabetic foot ulcers with A. debridement, B. the removal of dead skin, C. foreign objects, D. infections that may have caused the ulcer. An infection is a serious complication of a foot ulcer and requires immediate treatment. Not all infections are treated the same way. Tissue surrounding the ulcer may be sent to a lab to determine which antibiotic will help. If your doctor suspects a serious infection, he or she may order an X-ray to look for signs of bone infection. Infection of a foot ulcer can be prevented with foot baths, disinfecting the skin around an ulcer, keeping the ulcer dry with frequent dressing changes, enzyme treatments, dressings containing calcium alginates to inhibit bacterial growth, medications. Your doctor may prescribe antibiotics, antiplatelets, or anti-clotting medications to treat your ulcer if the infection progresses even after preventive or anti-pressure treatments. Many of these antibiotics attack Staphylococcus aureus bacteria known to cause staph infections, or SS hemolytic streptococcus, which is normally found in your intestines. Talk to your doctor about other health conditions you have that might increase your risk of infections by these harmful bacteria, including HIV and liver problems. Over-the-counter treatments. Many topical treatments are available for foot ulcers, including dressings containing silver or silver sulfadiazine cream, polyhexamethylene biguanide, PHMB, gel or solutions, iodine, either povidone or cadexomer, medical grade honey in ointment or gel form. Asterisk surgical procedures. Your doctor may recommend that you seek surgical help for your ulcers. A surgeon can help alleviate pressure around your ulcer by shaving down the bone or removing foot deformities such as bunions or hammer toes. You will likely not need surgery on your ulcer. However, if no other treatment option can help your ulcer heal or progress further into infection, surgery can prevent your ulcer from becoming worse or leading to amputation. Asterisk the outlook. The outlook depends upon the severity of the foot problem. As mentioned before, gangrene can be life-threatening if bacterial infection develops in the dead tissue area. Severe gangrene may result in the necessity for amputation of the affected area. Other foot problems are less severe but may nevertheless lead to reduced function or discomfort. Patients need to understand that for the best outcome of foot problems caused by diabetes is lifelong monitoring of their feet for problems and consulting their doctor immediately if a problem begins to develop.